Hello again. So far, we've talked about a lot of different things because there are so many things to think about. Although we always hope for the best, we do need to plan for whatever may happen. Dealing with pancreatic cancer is a tough journey for both the patient and their loved ones. As the situation evolves, what we may need to do is not only think about fighting the disease, but begin providing compassionate, full-time care. No one likes to talk about it, but it's important that we do, because in such moments, hospice services can provide support, comfort, and help to improve a person's quality of life during this challenging time.
The word hospice can often bring about feelings of fear and uncertainty, as many people associate it with the final stages of illness. But it's important to know that hospice services can help provide compassion and support for the patients over a long period of time, and those that provide the care know how to adapt to a family's unique needs. In this sense, hospice is often a source of hope and help for both patients and their families. It is designed to make the well-being of the patients the main focus, to make sure they feel heard and cared for during a challenging time. We hope you consider using this service. Begin by talking to your loved ones and then have a conversation with your doctor about your options and request a referral. Arranging for this type of help and getting approved to receive these services may take a few weeks, so discussing this with your loved ones and your provider sooner than later is a good thing. You may also consider connecting with other patients, caregivers, or support groups. Hearing from others can help you in this journey as you try to find more comfort and understanding. Their experiences can give you reassurance that this is right for you. You are not alone, and there are people ready to support you every step of the way.
During hospice care, you will meet a new team of professionals, including doctors, nurses, social workers, therapists, and spiritual counselors. Their main focus is to ensure that the patient remains comfortable while managing various symptoms that may arise as the illness progresses. These symptoms can include pain, shortness of breath, coughing, nausea, vomiting, insomnia, constipation, fatigue, anxiety, and others. As we discussed in the other videos, often there are things that can be done to help you better manage these symptoms. There is also additional emotional, mental, and spiritual support for both the patient and family members. If you don't already have it, this will help everyone better cope with the stress, anxiety, or fear that can develop during this stage. Please know that any kind of support you need will be provided by a trained counselor and chaplains of many backgrounds who will be respectful of your beliefs. Another significant advantage of hospice care is the assistance offered with basic needs such as helping you with personal hygiene, feeding, and dealing with bathroom needs, which often increase. This support allows families and friends to spend more quality time with the patient, creating cherished moments together.
There are several ways to get this type of care. When patients and their loved ones opt for hospice care at home, it allows for comfort in a familiar environment, while at the same time supporting family members as they focus more on what is most important, the patient. To make this happen, the hospice team works with the family representative to arrange a special space to keep all the necessary medications and equipment that might be needed. Equipment like wheelchairs, walkers, shower benches, and handrails can help the patient get around and use the bathroom and shower safely. Many of these things are actually covered by the health insurance or hospice programs. So ask a social worker or community health worker for guidance if you need it. It is important to note that at this stage, the patient may need care both day and night, so creating a caregiver rotation plan is important. While this care is usually given by the patient's family or friends, healthcare professionals typically visit weekly or more often as needed to provide training, checkups, and address concerns. And of course, doctors are available to answer questions. Some families may choose hospice facilities instead of in-home hospice. These facilities can be a group home or type of hospital that gives round-the-clock care by compassionate professionals. Loved ones are often allowed to visit at any time, so the goal is to make sure that the patient feels well cared for and is surrounded by love. Keep in mind that the patient may need arrangements for transportation to doctor's appointments, imaging tests, or blood work, regardless of the hospice setting.
It is really important for patients and caregivers to talk openly with the hospice team. Please share any changes in the patient's health, including new symptoms or medication concerns. If you have any worries or if the patient is in pain or needs more specific care, they are here to help. Caring for a loved one during this time is very emotionally tough. That's why caregivers need to remember to also take care of their own well-being. So don't hesitate to reach out for support. The hospice team can provide resources, including support groups for both caregivers and patients. You are not alone in this journey.
Talking about the end of life is a really tough topic, and it's completely understandable that many people would prefer to avoid it. However, having these conversations is incredibly important, and it's best to address them as early as possible by expressing your wishes and preferences when you are still better. You can ensure that your wishes are respected, which can bring a sense of peace and comfort and help your loved ones with this burden. We know that discussing these matters can feel like a whole lot, but we're here to provide you this guidance and support to help make this process a little easier for you. Your feelings and concerns, whatever they are valid, and we're committed to helping you to make this journey with care, love, and understanding. An important step for anyone, but especially for the patient at this stage, is to have plans in place. If you have not done this yet, and trust me, it's okay because many people wait a long time to do this, we encourage you to work together to complete and file the necessary documents. You need to have an advanced healthcare directive, which is a document or set of documents that includes a living will. This outlines the wishes of the patients and their family members in case things take a turn for the worse. Think about it this way. In an emergency, will people know what you want? It is always best to have thought ahead of what you want. For example, would you want extreme measures taken such as resuscitation or having a breathing tube in the mouth or nose? All these measures can keep a person alive longer but can be painful, and it's not going to cure the cancer. When these measures are taken, the patient may no longer be aware of what is happening to them. Having these conversations can be difficult, but sharing with your healthcare team what you want can ease the burden of your loved ones by preventing guilt and reducing uncertainty and conflict between family members during these challenging times. Your choices should be your own, and letting your loved ones know what they are is important and can provide comfort to everyone involved.
Don't forget, as a patient, you have the important right to make choices about your healthcare, including the decision to continue or stop treatments that may no longer help you. It is important that you are clear about your choices and that the hospice team and your loved ones know how to respect these choices. You shouldn't have to endure unnecessary suffering. Please ask for the comfort medications you need. And don't forget, your caregivers and family also need support during these difficult times so they can feel more comfortable dealing with unexpected and really tough situations. Be sure to talk with your doctor about your prognosis and treatment goals. Knowing whether you're focusing on palliative care or extending life can help you make decisions that truly reflect your wishes.
It's important to talk openly about the emotions you may be feeling, including anxiety, depression, fear, and worries. As hard as it may be, caregivers, family members, and friends should show empathy and patience when someone wants to discuss their feelings about the future. Listen, hold their hands, offer support through hugs, and let them know that you hear and accept what they want. That will help them feel understood and loved. Since this can be so tough, your healthcare team may recommend counseling for the patient and their family, including spouses, children, and grandchildren. This may help them better deal with feelings of sadness, guilt, or anger, all of which can be normal at a time like this. Don't hesitate to talk to your medical team. They are there to help you.
The final hours of life are a deeply sensitive time, whether it happens at home or in a hospice facility. Family members and caregivers, if your loved one wishes to stay at home, it's important to ensure that they have compassionate medical care and medication support. Make sure you have a number for the hospice nurse somewhere that is easy to find, and know that you can call at any hour, whether day or night. Consider sharing this number with multiple members of your family. In hospice care, kindly request permission for family members to be present with flexible hours, as their support can be comforting to the patient. Create a warm environment for sharing love and meaningful moments. If your loved one has spiritual beliefs, consider inviting a spiritual leader or setting up a peaceful space for meditation and prayer, and maybe music. Keep in mind that express desires of the patient as you go about providing additional comfort during this time.
In the final hours of your loved one's life, focus on the joyful, happy moments you shared together. Show your love, express gratitude, and offer forgiveness, as these gestures can help bring you and your loved one peace. Take the time to say goodbye and share your feelings, honoring your loved one in a way that aligns with their beliefs and traditions. This is why it is important to find out their wishes and have them written down ahead of time, so you know how best to honor your loved one in the way they would have wanted. When a person is aware that their final hours are near, they may feel anxious about several things, including their loved ones. They may worry about how their absence will impact those they care about, and whether their family and friends will be able to keep care of themselves without their support. Finances may be a concern, and by completing the proper documentation, you can ensure that they will be taken care of. We want to reassure you, dear patient, that your loved ones can find the resources they need to get emotional and spiritual support during this difficult time. To our cherished caregiver and family members, please remember that you are not alone. Don't hesitate to reach out for help and keep in close contact with healthcare professionals who can provide guidance as you navigate through your grief. Your feelings are valid and support is available for you too. Today, let's express love and affection because there is still time. We hope this information supports you in this process. We are your healthcare team and we are here to serve you. Let's work together, and please do not hesitate to reach out to us. Sending you a big hug.